Breaking: Measles case confirmed in NW, Iowa. What you need to know. A confirmed case of measles has emerged in northwest Iowa, raising significant health concerns. On Tuesday, the Iowa Department of Health and Human Services made the announcement, revealing that this particular case is associated with an adult who has no known connections to any other measles cases within the state. Interestingly, this individual has not traveled outside of Iowa recently, which adds an intriguing layer to the situation. Health officials have identified several locations where potential exposure may have occurred. If you have visited SuperHiTech or Kwik Star in Sheldon, or Casey's General Store on Division Street in Hull in the recent past, it is crucial to take necessary precautions to protect your health and the health of those around you. But here's where it gets controversial. The implications of this case extend beyond just the individual. It raises questions about vaccination rates and public health measures in the community. Are we doing enough to prevent outbreaks of preventable diseases like measles? This situation serves as a reminder of the importance of vaccinations and the potential risks of complacency. As we navigate this public health issue, we invite you to share your thoughts. Do you believe that more should be done to promote vaccinations? Or do you think the current measures are sufficient? Your opinions matter, and we encourage a lively discussion in the comments. Measles outbreaks in daycares, beyond health concerns, impact on families and childcare. Imagine the chaos when measles invades daycares. Health risks are just the tip of the iceberg. Measles is on the rise in the U.S., and child care facilities are hotspots for exposure, especially since many kids there are too young for vaccination against this highly contagious disease. While the immediate concern is the health of the children, parents face a daunting 3-week quarantine, forcing them to juggle work without reliable child care. Take Martha Martin from Iowa, for instance. She's been sharing her ordeal on social media after a visitor to her 9-month-old son's daycare in Cedar Rapids later tested positive for measles. This individual, despite being vaccinated, was one of 7 measles cases in Iowa as of July 15. Interestingly, not all these cases seem to be linked. It took public health officials several days to alert the daycare, but Martin's son, too young for his first measles mumps rubella (MMR) vaccine, received a post-exposure antibody called immunoglobulin. However, the notification came too late for an emergency MMR shot, which is effective within 72 hours of exposure. Martin and her husband rushed their son to the ER for the antibody treatment, facing unclear information about potential out-of-pocket costs. Other children from the daycare got immunoglobulin shots through a clinic organized by Unity Point Health, St. Luke's Hospital, and the local county public health department. The hospital spokesperson confirmed these details but didn't clarify the cost. Daycares are nightmare scenarios for measles outbreaks, warns Dr. Tina Tan, a pediatric infectious diseases physician and president of the Infectious Diseases Society of America. Babies too young for the measles vaccine are at high risk for severe cases if infected. Iowa's 21-day measles quarantine protocol for non-immune individuals is typical, given the disease's long contagious period. But Martin was told to keep her son home for 28 days due to the antibody treatment extending the quarantine. "I'm not sure what we'll do about work and everything," she posted on TikTok, which has garnered 2.5 million views. Martin initially agreed to an interview but later ceased communication. The Iowa Day Care directed inquiries to public health officials. A Lynn County public health spokesperson said they continue monitoring the situation after extensive contact tracing. The Iowa Department of Health and Human Services confirmed the daycare's openness and highlighted its protocol. Martin's son seems fine for now, but she knows symptoms can be delayed. While her employer is understanding, she'll use vacation days, and her husband will take unpaid leave. Her recurring message: "Get your kids vaccinated. Not doing so harms everyone." In March, a measles outbreak in West Texas hit a Lubbock daycare, infecting several children. Parents were told to quarantine their kids for 21 days. The daycare's co-owner told a local news outlet about their mixed precautions to stay open, balancing exposure risk and the need for income. America's child care system operates under varying state regulations for handling infectious disease outbreaks. Ruth Friedman, a senior fellow at the Century Foundation and former director of the Federal Office of Childcare, notes that daycares, already financially strained, could face major setbacks from such outbreaks, much like during the COVID-19 pandemic. Some parents expressed anger over quarantines, while others feared disease exposure. Measles can lead to severe complications like pneumonia, brain swelling, or even death, especially in children under 5 and pregnant individuals. The CDC reports that about 1 in 5 unvaccinated measles patients are hospitalized. The first MMR shot is usually given at 12 to 15 months, with a second dose at 4 to 6 years. However, children aged 6 months to 1 year can get an early shot in outbreak areas or for international travel. Iowa health officials now recommend an accelerated shot schedule, with the second dose as early as. Measles outbreak in Iowa, latest updates and precautions. Measles is back in the news, and it's more serious than you might think. In this week's episode of your trusted local podcast, Beth Maliki and Becky Phelps dive deep into the recent measles case tracked in eastern Iowa. They're not just reporting the facts, they're breaking down why this disease is still a threat and what you need to know to protect yourself and your family. You can find more on the specific case that sparked this discussion here, linked to KCRG article about measles case. But here's where it gets controversial. Measles was largely eradicated in the US, so why are we seeing a resurgence? Is it due to declining vaccination rates? Are there other factors at play? This is a question that sparks heated debate among medical professionals and the public alike, and the podcast aims to shed light on the complexities of the issue. Beyond the serious health concerns, the podcast also explores a fascinating economic initiative. Cedar Rapids Metro Economic Alliance is rolling out a new program designed to attract remote workers to eastern Iowa. And the incentive? A cool $5,000. Link to KCRG article about remote worker program. This is a bold move to boost the local economy, but it raises some interesting questions. Will it be successful in attracting long-term residents? Will it put a strain on existing resources? What kind of impact will it have on the local culture? It's a gamble, but one that could pay off big for eastern Iowa. And this is the part most people miss. It's not just about attracting new residents, it's about fostering a sense of community. That's why the podcast is also introducing a new segment called Hopeful Headlines. This segment will highlight uplifting stories from the local news, showcasing the positive things happening in eastern Iowa and celebrating the people who are making a difference. Think stories about local charities, community events, and acts of kindness. It's a reminder that even in challenging times, there's always reason for hope. What do you think about the measles situation? Are you concerned about the potential for outbreaks in your community? And what about the remote worker program? Do you think it's a good idea? Let us know your thoughts in the comments below. We'd love to hear your perspective on these important issues. Copyright 2025 KCRG. All rights reserved.